Greetings, everyone. I'm grateful to be part of this panel, and I want to thank Dr. Elaine Congress for organizing it and for inviting me to participate with such outstanding colleagues. My name is Melissa Begg, and I have the great honor of serving as Dean of the Columbia School of Social Work. The mission of the profession and of the school centers on social justice, with the goal of maximizing human well-being and ensuring that all can reach their full potential. I have been a population health scientist for more than 33 years. I'm a proud member of the social work community, but my career didn't start in social work. It started in public health. Both social work and public health share the same social justice roots, and both disciplines inform my views on health and human rights and how these are evolving in the U.S. context. One thing that has become abundantly clear to me over the course of my career is this: much of human suffering is manufactured. We engineer it through the policies and structures we put in place, but if we created them, we can fix them. Sadly, for too long, we have tolerated inequities that inhibit health and well-being. Race and zip code should not determine life expectancy in the United States, yet they do. And I think it's fair to say that COVID-19 and the pandemics of anti-Black racism, anti-Asian discrimination, anti-Semitism, homophobia, sexism, and so many other forms of oppression have only served to highlight the inequities that we live with and the degree to which opportunity and well-being are curtailed, sometimes severely, among certain members of our society, especially among those pushed to the margins. This is a systems problem involving educational, economic, political, cultural, criminal justice, health, and environmental systems. I'm going to share a slide with you. This is from a paper by Norton and colleagues on the social determinants of health and how they impact health outcomes. It's a complicated graphic and very likely reasonably accurate. While individual choices do contribute to health and well-being, they are more than matched by systemic influences. I think probably most of you are familiar with a quote often attributed to Archbishop Desmond Tutu. There comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. This is a great way to think about the things that influence health and the havoc that is wrought by the lack of social relationships, social supports, and a viable social safety net. This is an enormous challenge in the United States. I'm here with this wonderful interdisciplinary group, and among all of you out there, I know there are social psychologists, neuropsychologists, clinical psychologists, public health professionals, and social workers. All of us play a role in these systems. Some work with folks pulling them out of the river. And at the same time, we have to be working at the point at which they fall in or are pushed into the river. I want to state now what I believe to be a fundamental truth. We are all in this together. In the midst of COVID and a national racial reckoning, that truth has been underscored a million times over. Yet despite all that, we are not living up to this fundamental truth. The United States Constitution says that we need to promote the general welfare. But have we done that? Harry S. Truman, back in 1952, noted that some of his fellow politicians opposed almost all our programs to help the economic life of the country, and that they blindly turned their backs to the tradition of public action for the public good. Furthermore, he added, socialism is their name for almost anything that helps all the people. In the US, we continue to live with employment discrimination, lack of affordable housing, food insecurity, racial injustice, inadequate healthcare access, and brutally unequal scales of justice and opportunity. Fixing this involves a research agenda plus an action agenda. With respect to the research agenda, scholars are evaluating policy remedies and their impact on society. For example, my colleagues here at Columbia Social Work just completed an analysis of the impact of the 2021 child tax credit, which lasted 1 year. As of November 2022, analyses demonstrated that the child tax credit reached the vast majority of families with low, moderate, and middle incomes. It strengthened family finances despite precarious economic times. It helped to reduce child poverty to the lowest level ever. It decreased food insufficiency, increased families' ability to meet basic needs, and notably, it had no discernible negative effect on parental employment. The CTC has now expired. Many politicians have decried it as a welfare expansion. One senator even opined that parents would use the money to buy drugs. Updated analyses since its expiration show that we're now seeing lower disposable income, greater poverty, increased food hardship, and higher financial strain. Will we see impacts on health? Just ask Jamel Bowie, columnist of the New York Times, who said, today's disparities of health flow directly from yesterday's disparities in wealth and opportunity. As another example, many Americans espouse the belief that immigration has a negative impact on our society and our economy. Rigorous research by one of my colleagues points to the opposite, though. Legalization of undocumented immigrants opens up new work opportunities for them and reduces workplace exploitation. It also increases wages and the tax base. And in a final example, think of the opioid epidemic. Over the past few years, deaths from opioid overdose in the United States have surged, especially under COVID. At Columbia, the Healing Community studies a collaborative, community-based effort to reduce opioid overdose and death. This study is built on coalitions of policymakers, providers, government officials, business leaders, and perhaps most importantly, people with lived experience and family members who've lost loved ones to overdose. This is an excellent model for academic community partnership where community members co-design solutions for their environments. So, to move the research agenda forward, universities, research organizations, and think tanks need to continue that work. And then I think all of us have a role to play in the action agenda. I stated earlier my endorsement of the fundamental truth that we're all in this together. Mutual reliance is at the core of our existence, as has been all too painfully underscored by the pandemics we have endured. A failure to recognize our collective responsibility will condemn us to prolonging and deepening inequities, whereas a recognition of the power of collective action can lead to profound changes in well-being, especially among the most vulnerable. In the United States, what gets in the way of collective responsibility? Compared to other countries, it seems as though we in the United States struggle more with the concept of mutual reliance, of what we know owe one another. This may stem from this rugged individualism notion that has been long promulgated, a belief that people must be responsible for themselves. It's not a bad notion in and of itself, but it ignores the degree to which all of us depend on one another. And a whole lot of us have a whole lot more opportunity afforded to us simply by who we are at birth. This affects employment, housing, education, and so on. Racism and classism have been more prominent than ever due to COVID, not only in terms of who got sicker, but also in terms of who kept this country going and took more risks, who kept transportation going, kept the grocery stores open, kept the pharmacies open. It's a lot. Furthermore, too much is on the backs of low and middle income Americans. I'm going to share another image with you. This graphic from a book by Saez and Zuckman shows how the percentage of federal taxes borne by corporations has decreased dramatically over time, while the federal taxes borne by ordinary workers through payroll taxes have increased dramatically over time. How can that be right? Compounding this are perceptions of who is deserving versus who is not, as laid out in Jonathan Metzl's book, Dying of Whiteness. Me and mine, we're deserving, but those other people out there, not so much. This is a real challenge. How do we get around all of this? Let's start by pointing to successful examples of the power of collective action. In the US, think of the airport protests that erupted after the travel bans, the renewed uprisings against anti-Black racism in the wake of the murder of George Floyd, and the way we were able to repeatedly turn the curve on COVID when it mattered most. When the public sees opportunity for change, they can and do create it. I also think we need to concentrate on building empathy. From the earliest ages, there are school programs that aim to do this. Let's see what works and see what can be scaled and deployed widely. And let's not forget about promoting empathy among adults. One of my colleagues has designed a virtual reality experience of anti-Black racism, and she's in the process of rigorous research to demonstrate its efficacy in strengthening empathy in those who participate in it. Again, this comes down to what kind of nation we want to be, what kind of society we want to be, what kind of world we want to be. Because what affects me affects you, and there's no way around that. To my mind, the key will be interdisciplinary, interprofessional, cross-sectoral work on systems. In her book on systems thinking, Donella Meadows states that we have to be willing to see the system as the source of its own problems and find the courage to restructure it. Thank you, and I look forward to our discussion.